This is CARE TV, brought to you by CARE Communications, the country's premier health information management consulting and staffing company, leading the HIM industry in delivering quality services since 1976.
Sometimes as you plan your migration, you may miss the mark, and you need to reevaluate throughout that migration and decide if it's time to slow down the progression of the migration and address issues, because the nature of work queue activity is very repetitive. So if you can isolate what the issue is and resolve it with 15,000 records or claims versus 150,000 claims or records in backlog, sometimes it's worth halting that activity and thinking about your timeline effectively. The other approach is to look at additional resources, someone who has experience with that migration or the specific work queues. And if I can link it back to preparation, it's making those diagrams, thinking about the decision trees, and then modifying those as you go. What is working, what isn't, how do we address it? You need to be very responsive to change. Thankfully, we have a fair amount of experience with work queues in different environments and with different clients. That allows us to have a subject matter expertise based on our experience, as well as understanding the applications that use the work queue concept. So our help comes in the form of consultative subject matter expertise. It also comes in the form of manpower, also mentoring, and helping people appreciate the ramifications of choices that they make. Each organization will set it up to be customized to a certain degree, but we can help them appreciate downstream what those choices might mean. So I think, again, it comes back to subject matter expertise and experience, and CARE does offer that.
CARE has worked with facilities with misdirected data. By misdirected data, I mean that when a hospital migrates from a legacy system to a new one, some fields don't cross over properly and some don't cross map at all. So with one client, CARE provided trained staff to correct and direct information into the appropriate fields that had been in the wrong fields, and also to add the data and the information that didn't cross map at all. In another example, we provided staff for inaccurate provider information. How this happens is that when registration enters the name of a physician who orders a procedure, but sometimes that physician doesn't actually do the procedure. A data quality queue will catch that two different providers are in the system, so CARE provided credentialed staff to review the documentation and identify the correct provider in the system. Our clients understand that an EHR provides significantly more data and information than ever in the past, and that much of this data is going to be used to score their hospital outcome performances as well as reimbursement. Our clients are leading institutions that are taking the critical steps now to ensure that their data is of the highest quality.